The White House is launching a new effort to help Americans protect their health from the effects of climate change. The initiative focuses heavily on asthma and allergies. Chief Medical Correspondent Dr. Jon LaPook spoke with President Obama about the environment's impact on public health.
Mr. President, studies suggest most Americans don't connect global warming or climate change with their own personal health.
Right.
Why do you think that is?
Well, because it's not as obvious as some of the environmental issues of the past. And with climate change and rising temperatures, some of the effects are slow in registering in the minds of the public. But what we know is this: the planet is getting warmer. The science is indisputable. As springs and summers stretch out, allergy season is increased. That's going to have an impact on people's asthma, for example.
When I have a patient come into my office with asthma and they're wheezing, they want their inhaler.
Of course.
They don't want to hear about some long-term solution. You have two daughters who are teenagers. Are you thinking long-term because of them? Is that somehow part of the equation?
Well, you know, Malia, early on, when she was young, had asthma. And we had to visit the emergency room once. We had good health insurance, and we had the capacity to really knock it out early, so that over time she was able to, not have to carry a inhaler around. She still has allergies that have to be monitored. So I'm a dad like everybody else. I've seen how scary it is when your kid comes up to you, your 4-year-old, and says, I'm having trouble breathing.
Even if you're the President of the United States.
Even if you're President of the United States, it's nerve-wracking.
Dr. Jon LaPook is with us. Good morning.
Good morning.
So why now?
Well, he's having this multi-pronged attack, and I think it's probably because he realizes that it's unlikely that you're going to have any kind of climate change legislation go through Congress. I mean, Senator Inhofe threw a snowball down as evidence that climate change isn't even happening.
It's interesting they're connecting it to our personal health.
Well, yeah, but what he's doing is he's taking it right to the people. And he's saying, look, he said to me at the end, you didn't see it on tape, but change doesn't happen from the top down, it happens from the bottom up. So most people, when they think of climate change, they think about polar bears, melting glaciers, something happening on the other side of the planet, not something happening to them. And what he's trying to do here, and the literature is suggesting this, that it does affect people's personal health. And he's trying to say, here's how
How so?
Asthma has been on the increase. Certainly heat waves have been on the increase. And vector-borne illnesses like Lyme disease, chikungunya, and dengue, for example, are now in southern Florida. They never used to be that far north. So there are climate changes that are happening, and a lot of experts are saying that this is affecting not only our health, but things like these vector-borne illnesses that they're affecting us more.
I was looking at your monitors in the shot. I was wondering, do we need to worry about the president's health? But those were just props. Those were very intense.
It's like you guys
monitors.
were in an operating room.
It was a simulation center for the medical center.
We got it. Thank you, John.